Good afternoon. I'm Dr. Laura Fenimore, and I am very excited to have the opportunity to talk with a pediatric nurse practitioner today as part of our series about exploring advanced practice nurse roles. Today I'm joined by Jackie Calhoun, who is an acute care pediatric nurse practitioner at Children's Hospital of UPMC here in Pittsburgh. Jackie has a unique role in that she is also a faculty member at the School of Nursing. And so thank you, Jackie, for agreeing to join us today. And
of course, you're welcome.
Great. Let's begin by having you tell us a little bit about both of your roles and how you came to this journey of being an acute care pediatric nurse practitioner.
Yeah. So first of all, I wasn't a nurse to start. I was an engineer first during my undergraduate program, and worked as an engineer for 3 years, and found out that I really just didn't like sitting at a desk all day, and I really wanted to have a more socially impactful career. I come from a family of nurses, and 15 years ago when I was going back to school, that's when the accelerated programs were starting to really ramp up. And so I enrolled in one of those in Chicago and went back to school for nursing. I got my BSN, and then actually was hired into a pediatric intensive care unit as my first job. So I was a graduate nurse there, and have been in the pediatric intensive care unit ever since. I knew what a nurse practitioner was before I went back to nursing school. I was kind of interested in the role because it was then just because it was a provider. It was even more science-based than even bedside nursing, which is obviously very science-based, but it was it just seemed like a good fit. So I started researching that soon after I went back to school, and worked for a couple years, and then completed my MSN while I was working, so part-time. And so about 5 years after I started becoming a nurse, or after I started as a nurse, I graduated with my MSN and then started working as a nurse practitioner. Like I said, I've always worked in the PICU, so I was a bedside nurse in a couple different PICUs, which is Pediatric Intensive Care Unit, and worked as a nurse practitioner then, starting out in my first role, and that's what I still do now as a nurse practitioner. And I really enjoyed it. It's great.
So being a nurse practitioner, I think many people are familiar with the role of the nurse practitioner because they may see a nurse practitioner in their primary practice. But I think many students might not be as familiar with the role of an acute care nurse practitioner.
Mm-hmm.
So what's the difference between an acute care and a primary care pediatric nurse practitioner, and how is the education and preparation different for that role?
Yeah, so primary care pediatric nurse practitioners generally work in outpatient clinics. That's what they're trained for, to see what we call well children who don't have any acute or life-threatening health issues. It's the kind where you would think about someone coming in, a child to get their annual checkup and shots. But primary care nurse practitioners also do they can do sick visits in the outpatient clinic, and they can follow chronic conditions as well. So if a child has asthma, they can help manage that on a long-term basis, or maybe different growth deficiencies or developmental delays can be managed by a primary care nurse practitioner, a pediatric nurse practitioner as well. An acute care nurse practitioner, generally we work in an inpatient setting, either in an intensive care unit, whether that be a cardiac or like a medical surgical pediatric ICU. They can also work as hospitalists or on different specialty services within the hospital, such as endocrinology or renal nephrology services, cardiology services, different specialties like that. And along those same lines, those pediatric nurse practitioners can also work in those clinics as well, seeing those chronic patients. So it's not all necessarily inpatient, although that's where the majority of pediatric acute care NPs work. The training for both the acute and primary nurse practitioners start out very similarly in the pediatric world. And really for all nurse practitioners, you take, just like for your BSN, you take a lot of general nursing classes for nurse practitioners to start out with. Pathophysiology, physiology, pharmacology, differential diagnosis, statistics classes, and those are universal across all nurse practitioner programs. And then depending on whether you're in an MSN or a DNP program, you start to differentiate in your second or third year into your specialized classes, where you would take your pediatric primary care or acute care classes, and then you have a lot of clinical to go along with both of those. And generally you need 1,000 clinical hours for either one of the programs in order to graduate.
And so your journey was a little different than perhaps some of the paths that our students who are just starting out now might pursue, because there is now the option that nurses could move right from their BSN into a DNP program to finish their master's and to end up with a DNP as a nurse practitioner as opposed to a master's degree. Can you talk a little bit about the benefit of the DNP for the pediatric nurse practitioner and why you chose to enroll in this program at Pitt?
Yep. So as Dr. Fenimore said, and as kind of I alluded to, I didn't start out with a DNP as a nurse practitioner. I actually was the next to last class at Rush University where I went that was MSN, and now they only offer DNP programs as well, which is what most of the more prestigious nurse practitioner programs are now, are DNP programs. And I think that's to the benefit of our patients, really, and which is one of the biggest reasons why I went back to complete my DNP. The classes and the knowledge the class that you take and the knowledge that you gain from your DNP really help you to become a better provider and really a healthcare leader. And it helps you conduct research and translate research, which I know you always think maybe a PhD would do that, but that really is, especially with quality products and projects, what a DNP is good at. You're better able to critique the information that you're given, which I think makes you a better provider for your patients and families. And I think it really just demonstrates, a commitment to your field too, that you're really going above and beyond what you could be doing in order to best prepare yourself to be in the role that you're in.
Very good. So tell us about what a typical day looks like for you and your role when you are at Children's.
Yeah. So my day, I work in the ICU, as I've said, and I'm one of the frontline providers, or like the go-to person basically for my patients. I have up to 8 to 10 patients at a time. And I get here pretty early. I start at 5:30 in the morning, but that's when the night team transitions over to the day team. So the first thing I do is come in and get my patients and then get sign out, they call it in the medical world, which is just like nursing report basically, as I hear about the patients and the overnight events and what's going on with them. And then I go around and examine all of my patients. The next step of the day is interdisciplinary rounds with the whole medical team and nursing and respiratory therapy at each patient's bedside. And so I present all of the data and my plans for the patient for the day. And then we talk about, those plans as a group and review them hopefully with the parents who are often there and come up with a good plan of care for the patients for the day. And then after rounds, I do a lot of tasks almost for the patients. So I order and interpret tests and laboratory results and exams, radiology exams. I perform procedures, so I place central lines and arterial lines. I do intubations and lumbar punctures. I feel like I'm missing one. Oh, a lot of sedation. I run a lot of sedation for patients who are undergoing other procedures and tests. I talk to a lot of people on the phone, so a lot of different consults, and asking them for recommendations for our patients, and help to put those recommendations into actions if they're appropriate. And then most importantly, it's really interacting with the patients and the families and find out what their concerns are and their needs and helping to best address those in the unit.
It sounds like a pretty complex role.
It's awesome. Yeah.
Yeah. What do you love about being a pediatric nurse practitioner?
Well, one of my favorite things is the variety, which is one of the reasons why I left my initial role way back when as an engineer. I really just like I can describe to you what my day just looked like, but at the same time, there's so much variability between those days, and the variety of patients in the ICU, in the pediatric ICU, is, I think, unparalleled than anywhere else in medicine and nursing. But it's really the connection that you build with the patients and families, which is awesome. And we see a lot of this again and again in the ICU, and so you get to know these families and you get to see them through their journey in healthcare, and it's really rewarding. And I think the last thing is that kids are so resilient, and they don't feel sorry for themselves. It's really great. They can just keep playing and keep doing whatever they, however they, just like a regular kid, as much as they can, just like a regular kid, which is pretty neat to see.
That is fun. People often said to me that my clinical practice is as an oncology nurse, and they would always say to me, oncology isn't that hard. And I was like, no, taking care of 6 kids, that's hard. So how do you deal with the emotions of seeing acutely ill children and the suffering that they're experiencing in the ICU and the suffering of their families?
Yeah, honestly, sometimes the suffering of the family is harder, especially when it's something very unexpected, which does happen. I think it's a lot of compartmentalizing at first when I'm working, just to make sure that I'm, thinking about things clearly and doing my best to take care of patients as well as I can. And then there's a lot of the work-life balance that has to go into this job. So I'm big into running, and that's really how I get a lot of my stress out. And then really trying to leave work at work once I leave. So I have a family and I have kids of my own, and I really don't think or talk much about my job once I leave here. And I think that's really to the benefit of everyone.
Couldn't agree more. So as part of your DNP, you did a scholarly project.
Mm-hmm.
Tell us a little bit about what you did and what difference did that project make?
Sure. So my scholarly project was the development of a pathway, or 2 pathways, I guess, for liver transplant patients here in the PICU. We actually have a significant population of transplants here at Pittsburgh, one of the busiest centers. And we didn't have a nice written out pathway to help guide the care of these complex patients as the care teams were getting larger and the patients were getting sicker. We're just transplanting kids who have more complex medical conditions, and more of those kids than we used to. And so I developed an interdisciplinary team, included surgeons and doctors and quality team members and myself and nurses, who develop pathways based on our best evidence, because unfortunately there's not a lot of actual nice data out there about what's best for pediatric transplant patients, because it's a relatively small overall population in the world. But we develop pathways that can be used postoperatively to help provide the best care. we found that the pathways didn't make a lot of difference in the overall like outcomes of the patients, but what we did find was the staff satisfaction went up with them, which was, I think it helped us prove two things. One, that we already were giving great care to these patients, which we thought we were, but then it also showed that just good communication is something that everyone appreciates. And the pathways are actually being implemented as part of the new, maybe implement is not the right word, but they're being incorporated. That's the word I went into, the bedside binders for all of the nurses now. So they're going to continue to be used, which is really nice.
That's fabulous. Great.
Yeah.
Talk a little bit about licensure and certification and what the difference is, and can you practice independently, or do you have to work with a medical physician? Tell us about that process.
Yeah. So the acronym that everyone talks about for nurse practitioners is called LACE, and the L stands for licensure, A is accreditation, C is certification, and E is education. And all of those letters need to line up for different nurse practitioners to work with the population that they want to work with. So, and unfortunately, the letters are out of order in the way that you would think of them. But you need to be educated from an accredited program. Those are the A and the E. And when you're considering becoming a nurse practitioner, you need to think about the population or know the population that you want to work with from the onset of your education. Because as the consensus model, which you may have heard about, is being more implemented, which is a consensus statement that was put out by a number of different nursing organizations around the country to help align nurse practitioners with populations, to making sure that people were working with populations with whom they were trained and educated to be working with, is becoming, as that consensus model is becoming more implemented, it's becoming more important to be educated and certified in the right fields so that you can keep your job later, because there's a number of nurse practitioners around the country who were educated in more general programs that are working in more specialized fields, who are having to go back to school now because it's just not, their education and certification are not aligned. So back to the LACE model, there's a number of different nurse practitioners, programs, which I'm sure you've heard about, which are, family nurse practitioner, which is the most general, which is intended to be an outpatient nurse practitioner who treats a variety of ages from child to adult, with some, gerontology in it as well. There's a pediatric that we're covering now. There's adult acute care and adult primary care, which are similar in scope to the peds acute care and primary care, just with adults. There's neonatal nurse practitioner who treats neonates and premature infants in intensive care units. And there's just other nurse practitioner programs as well. Women's health is the other one I think I was trying to think about. But basically all of those have specialized education and then specialized licensures that come after that to help you be educated and trained to treat different populations. So then your licensure, as I kind of just mentioned, is based on what program you graduated from. And the licensure and your scope of practice are state dependent right now. So every state, nearly every state has their own rules about what nurse practitioners can do and how independent they are in their practice. I believe last I looked, there are 28 states where nurse practitioners have full practice authority, which means they can practice independently with their own license. They don't have to have any collaboration with a physician. And a lot of these rules were enacted to help medically underserved communities where there's just not enough physicians to cover, and now there are nurse practitioners who can work in these underserved areas. Other states, Pennsylvania, for example, require nurse practitioners to be in collaboration with a physician or physicians. So I have to have what's called a collaborative agreement with a physician who is basically saying that supervising isn't the right word, but it comes down to that basically, that they're the ones that are making sure that I'm doing what I'm supposed to be doing and working within my scope of practice. Mm-hmm. And they're also the ones who co-sign my prescriptions as well that I write. Mm-hmm. Unfortunately, Pennsylvania is one of the more restrictive states, but there is legislation that's pending. Although I just heard last week that it's become more restrictive again without being passed. So we'll see. But
yeah, it's a story that is still unfolding here mm-hmm. in Pennsylvania.
Unfortunately, yep.
But there is certainly the positive recognition that we do need help, particularly in the rural areas, and that nurse practitioners can fill a very important void in those areas as mm-hmm. well. So Jackie, as we wind up our conversation, I wondered what advice you would offer to a nurse or a nursing student who is interested in pursuing a career as a pediatric nurse practitioner, particularly an acute care pediatric nurse practitioner.
Yeah, first of all, I'd be so excited if people were interested. We welcome everyone. But my first advice is to make sure not to rush into a program. I would make sure that you have RN experience first, particularly if you can in the area that you're interested in becoming a nurse practitioner. So if you'd like to work in the ICU, try to find an ICU job. If you'd like to work in the clinic, try to find a clinic job. And I think that's really to get a feel for what you're going to be getting into, but then just to make sure that that's really the population that you're interested in working with. Mm-hmm. And then along those lines, I think it's really important to try to find people to shadow. If you can spend time, with a day or two with a nurse practitioner in different areas, you can really get a feel for what they're doing and have a conversation with them about, what their days are like. And then I would really encourage people to look for the best programs they can. I think a lot of nurse practitioner programs, there are a few that you can, do quickly, but I think the quality of the education and your experience is not going to be as good as if you spend your time looking for a program that has, better quality of education. And I would, as I mentioned, I think you should look for DNP programs.
Very good. Is there a journal that you might refer students to if they wanted to read examples of articles and projects that pediatric nurse practitioners are involved in?
Yeah, so it's very easy to remember. It's the Journal of Pediatric Nurse Practitioners. It's published by Knapnap, which is an acronym for the National Association of Pediatric Nurse Practitioners. But all of their articles are pediatric focused, and I think nearly all of them are written by pediatric nurse practitioners, and they have a variety of settings in which the projects have taken place. So that's my go-to journal.
Oh, wonderful. Well, Jackie, I can't thank you enough for giving us your perspective to allow students to hear your story. And I know that if there are students who are interested in talking more with you, I would be happy to refer them to you.
Yes, that'd be wonderful.
Wonderful. Well, thanks so much.
Yeah, you're welcome.